This is Janet Louie from the California Housing Finance Agency. I'd like to welcome everyone to the Section 811 Project Rental Assistance Demonstration Program. This is our second round of funding. Just wanted to give you a couple of housekeeping. We will be taking, everyone is on mute. We will be taking questions throughout this presentation. To enter questions, you go ahead and expand your question box and type in your questions. There's also will be handouts that you can click on that you could download as a PDF to follow this. We will be recording this webinar, and if the recording comes out, we will be posting that on the website along with our handout. We will have multiple presenters during this webinar, and the first presenter to start speaking is Christina from HCD.
Good morning, everyone. My name is Christina DiFrancesco, and I'm from the California Department of Housing and Community Development. I'm one of 5 partner state agencies in this collaborative, which includes the California Housing Finance Agency, the California Tax Credit Allocation Committee, California Department of Healthcare Services, California Department of Developmental Services, and our local partners in LA who have been instrumental in this second round of funding and helping us put together this program design. So I do want to thank them very much for all of their efforts. For those of you who aren't familiar with the 811 program, it is a demonstration program that is a partnership between HUD and the Center for Medicaid Services federally. And the idea behind the program is to generate savings in Medicaid by taking people who are currently or could be costing the Medicaid system large amounts of money because they are cycling in and out of healthcare facilities or have been in long-term institutional care, and bringing those people into the community, back into the community, providing them affordable housing with long-term services and support funded through Medi-Cal. So that's the basic policy goal behind the program. Round 2 is specifically targeted to LA County. What I'll do is I'll go over some critical dates and give you kind of an overview of some changes from round 1 to round 2. Round 1, we issued the NOFA in August of 2014. That is statewide, and we continue to fund projects. So if any of you are thinking about doing projects in LA County or in other counties in the state, you can always apply under round 1. But the focus of today is the round 2 design. So round 2, we signed our HUD grant agreement this past November. We released our NOFA a couple of weeks ago, and we'll begin accepting applications on an over-the-counter basis, meaning we'll accept them until we've committed all the funds, beginning next month, mid-month, around March 16th. And pursuant to our HUD grant agreement, we have to have all of the units initially occupied by tenants by November 2020. So 5 years from when we have executed the grant agreement with HUD. Changes from round 1. Basically, this round 2 expands the target population. The population for round 2 not only includes persons that are currently institutionalized, but also people that are homeless, people that are at risk of institutionalization because they have a serious mental illness, and also people who are at risk of institutionalization because they have a developmental disability. As some of you may know, the state has been closing its developmental centers. There are 2 or 3 more slated to close in the next few years, and so we're trying to make a concerted effort to make sure that we can provide some housing opportunities for folks as they leave those institutions. Continuing on, we are expanding the homeless population, or the population for round 2 to homeless. So for those referrals to projects funded with 811 assistance, we're going to use the LA Coordinated Entry System. For the non-homeless referrals, the Department of Healthcare Services will be coordinating those referrals. And we're going to expand the types of waiver services that people can receive in order to be eligible for 811 assistance. In our first round, we had a needs-based formula for determining how many units people could apply for. In this round, what we found over time is really what governs how much people can access is really HUD's statutory requirements, and I'll go over those in a second. So we've eliminated any other state restrictions that we were previously imposing on how many units a project could apply for. There are also some ways that in this round we can layer local rental subsidy on top of the 811 assistance to bring up the contract rent. And we were able to get some further clarity around phase 1 in affirmative marketing requirements as we pursue this second round of funding, and I'll talk about those in a little bit. So to get into the meat of it, the Section 811 project-based assistance is rental assistance provided to an affordable housing project that is receiving state financing either through TCAC, HCD, or CalHFA. One of the unique features of the program is that the rental assistance contract rent is capped at 50% of the tax credit rent for the project, whatever that applicable tax credit rent would be based on the place and service date of the project. One of the things that HUD is trying out through this demo is experimenting with ways to control costs for Section 8 and Section 8 renewals. As many of you know, Section 8 is taking up more and more of HUD's budget, and that's putting a squeeze on new development programs such as home and CDBG. And so HUD's trying to experiment with different ways to do it by marrying their assistance with local subsidy, and fortunately in LA we have that opportunity. The Section 811 assistance will pay the difference then between 30% of the tenant's income and that 50% AMI TCAC rent. As I said before, we can combine local rental subsidy on top of that to bring up the contract rent, and I'll talk about that in a little bit. The initial assistance through the demo program is 5 years, and then after that, all of the Section 8 goes into the regular renewals pot and is renewed on an annual basis. There's a 20-year rental assistance contract with a 30-year use restriction that CalHFA will talk about in a little bit. And CalHFA will be administering the rental assistance contract and payments for the period of the RAC. Eligible tenants. The tenants have to be 30% AMI or below. They have to be disabled, and they have to be eligible for long-term services and supports funded through Medi-Cal. And there are a range of things that qualify under that umbrella. I've listed a few of them here, and Ursula from Department of Healthcare Services is going to talk about them in more detail in a little bit, but basically there are things called home and community-based waiver services, specialty mental health services, which we know will be a particular use for folks that may be homeless, and then other state plan services such as in-home supportive services, which many of you may be aware of, and the new health home services that have started to be instituted here in California. So we tried to design the umbrella of services to be very large, and we anticipate as new things come online through Department of Healthcare Services and the various waiver programs and options that they get approved, that those will also come under the umbrella, so that we can provide as comprehensive a range of services to tenants as possible. And importantly, through this demo program, pursuant to HUD requirements, all of the tenants have to be non-elderly, that is, ages 18 to 61 at the time they initially occupy the unit. So in terms of the target populations, I'm going to go over each one of them in detail. We kind of divide it initially into two buckets. The first being the non-homeless PRA tenants, which are our kind of traditional round one tenant populations. Institutionalized being the first, and that means that the folks must have resided in an institution for more than 90 days, with Medi-Cal paying for at least one of those bed nights. And on this slide, I've listed some examples of the kinds of institutions that we typically see people coming from when they fall under this category. But again, I think Department of Healthcare Services is trying to keep the umbrella as broad as possible in terms of this list, as long as Medi-Cal has paid for at least one of those nights and they've stayed for at least 90 days in one or more of those institutions. Moving on, the at-risk of institutionalization population. In this round are persons with developmental disabilities or serious mental illness who are at risk of either short-term or long-term placement in a county or other inpatient facility if they don't receive our rental assistance to keep them housed with the long-term services and supports. And this could include people currently institutionalized on an emergency basis. So we know, for example, in the homeless population or in the population, since we're talking about at risk, non-homeless, of persons with serious mental illness, that people sometimes cycle in and out of county health facilities or have short-term stays in IMDs. And so we wanted to try to, again, keep this umbrella as broad as possible to provide as many Medi-Cal beneficiaries or persons eligible for Medi-Cal with that opportunity to access those long-term services and supports and rental assistance. Among the homeless bucket, excuse me, folks must be homeless under Section 1 of HUD's definition, which essentially means they must be literally homeless, meaning they currently lack a fixed, regular, and adequate nighttime residence. And many of you, I'm sure, are familiar with this definition. Basically, they have to be in the streets, in shelters, or they can be institutionalized, but they must have been homeless before they entered an institution, and they can't stay for longer than 90 days. Otherwise, HUD considers them officially institutionalized and not homeless. So we have these various subpopulations, and so when we sat down to figure out how we would design a program that would be all-inclusive and give everybody an opportunity to access the assistance, we basically are dividing the bucket of funds into 4 categories of 25% each. We estimate that we will have about 248 units with this approximately 11 million that we have available. And so for our initial cut, we're going to allocate 25% of the funds for institutionalized populations, 25% for persons with developmental disabilities who are either institutionalized or at risk of institutionalization. And I have to say that the first bucket, 25% of institutional, is not disability specific. So that's broad. And then The second DD is just DD, but they could be either institutionalized or at risk. And similarly, for persons with serious mental illness, they can be either institutionalized or at risk. And then lastly, people who are homeless is another broad bucket that's not disability specific. And people who are at risk of institutionalization who have a serious mental illness can also draw from that bucket as well. So we've tried to make some distinctions, but we also realize that people could fall into more than one category, and so we're also going to try to be flexible. And we may periodically consider adjusting the allocations to make sure that we're fully utilizing the funds, but at least initially, this is how we're going to do it. So when a sponsor submits an application for funds, so that would be the developer/sponsor, and we'll get to that in a minute, you will designate which target populations you wish to serve with your PRA funds. If you choose to serve developmentally disabled or people with serious mental illness, you must designate, in addition to that target population, at least one other target population, because HUD is requiring us to make sure that we design a program that serves a range of people with disabilities. And so we want to the extent we can, get away from projects with just one targeted disability-specific group for the 811 funds. In addition to the Section 811 assistance, which is part of the demo program, when we competed for these funds in the national competition for this round, because we were working in LA County, we had the cooperation of the city and county housing authorities in putting up essentially match dollars, which are their own housing choice vouchers that will be targeted for homeless folks who also fit the Section 811 eligibility criteria. So in addition to the demo pot, the $11 million, we have 100 housing choice project-based vouchers allocated by the city housing authority and 50 allocated by the county housing authority. And that was also enabled us to get some extra points in the competition for leverage. So we're really happy that we're able to engage the housing authorities as partners in this phase of the program and add more resource to be able to serve the Section 811 homeless target population. And we have enjoyed our collaboration with them thus far and look forward to doing more in the future. We will be issuing that assistance through their own NOFA processes, through the local housing authority or the CDC as it works for them locally. And we've started working with the city on putting together some kind of incentive in their upcoming NOFA for the 811 target population specifically. So again, I want to thank them for their great cooperation with us and working with us on the design and moving forward full steam ahead with us on this. The tenant referral process. So unlike round one, which was kind of a decentralized tenant referral process where each project partnered with a local tenant referral organization, round two will be more centralized in terms of the referral process. For folks who are homeless, projects will get referrals of those folks from the the LA Coordinated Entry System, or CES. CES will pick those 811 eligible folks based on the criteria that I just discussed, plus their own VI SPIDAT score or other CES assessment tool appropriate for the person at that time. They'll provide the referral to the project within 30 business days of notification that the project has an available unit. And the project then must enter their unit and tenant information into the Homeless Management Information System that CES uses. For non-homeless referrals, kind of our second big bucket, those referrals will be coordinated through the Department of Healthcare Services. They are going to have a person down in LA County who'll be working with people up here to make the referrals. And DHCS will be working with the local tenant referral organizations through their nursing facilities, institutionalized population facilities, the regional centers in LA County, as well as the LA County Department of Mental Health for people with a serious mental illness who are not homeless but are at risk of institutionalization. And so they will be coordinating that referral process, and again, will make referrals within 30 business days of notification of an available unit. As in round one, institutional placements will get priority over those not currently institutionalized. If we're in a situation where you've got an institutionalized person and a non-institutionalized person that are both ready to move in at the same time, but there's only one unit available, for example. Okay, at this point I'm going to stop and we'll take some written questions.
If you would like to go ahead and type in your questions in the question box, we will go ahead and take those at this time.
Seeing no questions, I'm going to turn it over to Gina Ferguson from the Tax Credit Allocation Committee.
Hi, this is Gina Ferguson from TCAC, and I'll be going through the next few slides. First being eligible 811 PRA applicants. This is the entity that completes the application. The applicant is a developer or sponsor or a parent company of a single asset entity project owner. The applicant must have an ownership interest in the project, and the project owner will typically be a single asset entity, but isn't required to be. The owner will execute a RAC with CalHFA. Eligible projects are multifamily rental housing projects with 5 or more units and with state financing from either HCD, CalHFA, or TCAC. Projects are completed or planned new construction or planned rehabilitation. If construction activity is begun with no other federal funds besides the 811 subsidy, they must wait until completion to apply because of issues related to federal environmental clearances and Davis-Bacon compliance. And we'll talk a little bit more about this later. There's a requirement that no more than 25% of the units receive 811 PRA subsidy, be restricted to supportive housing for persons with disabilities, or have occupancy preference or restrictions for persons with disability. So all of those categories, there's a maximum of 25%. And that's part of HUD's program design. The identified 811 units cannot have received another form of rental or operating subsidy 6 months prior to receiving 811 programs. And there's some distinctions here, so we'll go, the next 2 slides go into that in a little bit more detail. The PRA assisted units can't currently be receiving MHSA operating subsidy but they can have received MHSA capital or MHSA funded services. Locally financed operating subsidy concurrent with the 811 is fine. The 811 project rental assistance must be for units with a targeted AMI of less than 50%. Christina went over that earlier. The subsidy amount cannot exceed the 50% AMI rent, which is TCAC rent. It can layer local subsidies such as FHSP on top of the PRA assistance to bring the total contract rent to fair market rent. And it can put 811 units and housing authority project-based vouchers in the same project, not on the same unit though. And can use PRA funds on units without MHSA subsidy. And just remember the 25% rule applies. If you're reading the NOFA, pages 14 and 15 go into this in more detail, and they're a good resource that explain these bullet points in more detail. At least 5 units must be proposed for PRA. The maximum units proposed in an application is 25% of the total units in the project, unless there are other units that are restricted for the disabled. If there are other units restricted to persons with disability, these must be counted toward the 25% limit rule. There is an applicant or property manager experience requirement. At least one project must be operated with services to special needs populations, and there is a requirement to have experience with Section 8 tracts, EIV, and rent calculation experience. And Section 8 assisted projects have no significant state monitoring findings or project compliance issues. Project suitability projects must have access to appropriate services for the expected tenant population, accessible transportation, and facilities to ensure greater integration of persons with disabilities in the broader community. To complete this section of the application, provide a brief description of these amenities, and it is helpful to provide maps and any other information usually available online that helps describe the features that you've summarized in this part of the application. The next few slides will go over the federal overlay requirements, and we've listed the bullet points. We'll have a slide or more on each of these items coming up. Starting with housing standards. Applications must include a signed certification from an architect or other qualified inspector stating that the Section 8 assisted units meet applicable housing codes, ordinances, zoning requirements, and minimum UPCS. Accessibility. The developer must ensure the project is accessible to individuals with disabilities, and the Section 8 projects must meet Uniform Federal Accessibility Standards, UFAS. They must also meet Section 504 accessibility requirements, Federal Housing Act Design and Construction Standards, and also the California Chapter 11A accessibility requirements. So that's California Building Code Chapter 11A. These standards are the ones that are in place at the time of project construction or rehabilitation, not necessarily the newest standards. And there must be a signed certification from the project architect or a qualified third-party inspector related to these requirements included in the application. Affirmative marketing, project owners and tenant referral organizations, or TROs, must take action to provide information and attract eligible 811 tenants. The affirmative marketing analysis is done annually, and the marketing is due to those is to assist those least likely to apply due to underrepresentation by race, sex, ethnicity, and national origin. The affirmative marketing must be done prior to the start of the general program outreach and referral. Institutional and regional center referrals. The affirmative marketing form in this case is done by DHCS and DDS tenant referral organizations using the affirmative marketing form and applicable data sets. DHCS and DDS will work with the TROs to complete this analysis. For homeless and LADMH referrals, affirmative marketing is done by the developer and owner using standard HUD affirmative marketing form. And this is done in conjunction with the CES TROs or LADMH. And page 16 of the NOFA goes into more detail about this, and it's a good resource. For homeless referrals, a project's affirmative marketing materials must include CES, contact information, and direct project applicants to service planning area leads within the CES system in order to be considered for PRA units. Tenant selection, project developers or sponsors must submit PRA tenant selection plan to the state for approval. There is a sample round 2 tenant selection plan posted on the website. There's a link on our slide right here. It's posted in February. Projects have permission to deviate from the plan previously approved in connection with other state financing in order to meet PRA requirements. And there is some more information on page 17 of the NOFA. For the PRA set-aside, which is based on the designated target population, vacant units must be made available to PRA eligible units for a minimum of 30 days before leasing to a non-PRA tenant. Section 811 tenant screening requirements, reasonable accommodation rules, and fund source minimum occupancy requirements apply. For waiting lists, the non-homeless waiting list, DHCS will manage this waiting list. For the waiting list related to homeless persons, CES will have primary responsibility in making referrals of PRA eligible households. In the event there are more tenant referrals made from CES than homeless that are available, a PRA waiting list for these units must be maintained by the project. And an eligible tenant with legitimate reason for rejecting a particular unit can do so. The unit can then be offered to the next eligible tenant referred by DHCS or CES as applicable, with the other eligible tenant retaining their same position on the waiting list. Property managers and TROs must ensure that tenants can exercise housing choices among suitable projects within the community where they want to live. Section 811 units must be dispersed and integrated through the property, and projects must provide full disclosure of basic information about the units, access to transportation facilities around the project, and they must also provide a good estimate of wait time to be admitted to the units of different sizes and types. And more information about this is provided on page 19 of the NOFA. Project owners must take reasonable steps to ensure access by persons with limited English proficiency. The application must describe types of limited English proficiency assistance that's provided to persons residing or seeking residence in the proposed project. HUD has also provided guidance on this, and you can see page 19 of the NOFA for some additional information. Davis-Bacon requirements are wage determination requirements. These requirements are applicable to applicants of 12 or more 811 PRA units. They're triggered if the 811 PRA application is submitted before new construction or rehabilitation activity is complete. Once construction activity is underway on a project that's not otherwise subject to Davis-Bacon wage requirements, those projects must wait until construction completion before applying for the 811. There are energy and water conservation requirements related to the program. And for new construction and gut rehab projects, these must meet the requirements of the EPA Energy Star program. Installation of water conservation fixtures is required, such as low-flow shower heads and high-efficiency toilets. and the application will include a narrative explaining how the project meets the requirements. So that will pause with questions, and then Christina will resume the presentation.
Okay, this is Yvonne, a question from the Department of Developmental Services, and I'm going to read one of the questions that has been provided. For those of us outside Los Angeles County, how much is left in round one funding?
So we have about 30% of the funds committed at this time. We funded 9 projects. We're about to fund our 10th. One of the really great things about having the lower contract rent is that we're able to fund a lot more units than we initially projected. We initially projected about 253, and right now at 30% committed, we're at about 105. So we do have funds available. It's been a nice steady stream. And so we would encourage people to continue considering applying. It is going to require that we fund more projects and do more project recruitment than perhaps we had initially anticipated. But at the end of the day, we're probably going to get close to about 300 units, which is very exciting for round one, and we're very happy about that. So call us and we'll work with you to develop those partnerships with the tenant referral organizations and get you going. We have a very streamlined process, and I think it's been fairly easy for those 10 projects that we've been working with thus far to get going, at least from our end. So.
Does anybody have any other questions that they'd like to ask? If so, they could go ahead and type in their question.
Okay. Seeing no other questions, I'm going to continue on and finish up with some environmental requirements. So those of you that know the history with round one, we worked really hard with HUD to try to streamline the environmental review process since we're not providing construction dollars with these funds, and we want to make it as easy as possible for people to access the assistance, projects to access the assistance. So For existing projects that are currently HUD assisted or HUD insured, for example, you exist, you're complete, and you've got home or CDBG funds or CalHFA mortgage insurance, there's no further environmental review that we need from you on the project. So that's good and easy. For all other projects, which includes existing projects that don't have any federal funds or federal insurance, such as projects that just have TCAC and maybe some soft money state financing from HCD, like MHP, for example. Those projects and projects that are not yet started with their new construction or rehab, so will be under development, those projects still have to go through an environmental review process, but it is fairly streamlined. If the project has already started construction or their rehab activity, then you have to wait until you complete to apply to us so that you don't have any choice limiting actions. But if you haven't already started, you can go through our streamlined environmental process, which includes the following. You can submit a letter to us certifying that the project is not on a Superfund, CERCLA, or equivalent state list, which says that it's toxic, that the project isn't located within 3,000 feet of a toxic or solid waste landfill, that there are no underground storage tanks other than for residential fuel, and that there are no known or suspected contamination sources by toxic or radioactive materials. And so you submit the letter to us, and then we'll verify that that is in fact true by searching the applicable databases. But it will require you just to submit that letter. If the project is in a position right now in its stage of development where you can't certify to that, then the alternative is to submit to us a current phase 1 or a phase 1 prepared within the ASTM requirements for a current phase 1, which is it must have been prepared within 180 days of the property's construction, rehabilitation, or refinancing. Then with that phase 1, we can see, in essence, what the condition of the property is and verify with your state development financing source that you have steps in place in order to remediate whatever conditions you have to remediate pursuant to the phase 1. And if the phase 1 calls for a phase 2, if you have any recognized environmental conditions, we'll need to see the phase 2. If you don't have a phase 1 available at the time that you apply to us, in other words, you're still getting together your financing and haven't yet done your phase 1, you can submit it to us later as long as it meets the timing requirements, that 180-day requirement, and we get it at the time that we notify you that we're getting ready to make an award, so that we can do that review of the phase 1 before we award you. In addition, what you have here is what I would call modified statutory worksheet type of analysis. PRA, since it's project-based rental assistance, is governed by Part 50. So it is a Part 50 review, but it's based on many of the same statutory requirements that are under Part 50H. And so what you see in our application is a step-by-step question and answer which guides you through that process and asks for the applicable documentation with links to websites that you can go to get that information if you haven't already compiled it as part of your environmental review process. And here's the list of items. They're fairly standard. I'm sure many of you have seen them before. So we'll just require that we see documentation that the issue is a non-issue or that it's being addressed. In particular, I also wanted to talk about the floodplain requirements of PRA. So HUD has said if you are a new construction project, meaning you're not yet complete, you can't be located in a 500-year or a 100-year floodplain. We have many projects that are not, and then we had some that have been interested that are in 500-year floodplains, and so they have waited until completion or will wait until completion to apply to us. This is under round one. So that is an option for you. And then if you're in an existing structure, meaning you've completed your rental new construction or your rehab, you can't be in a coastal high hazard area, a V zone, or a regulatory floodway. You can be in a floodplain, 100-year or 500-year, if you're flood-proof or elevated above the floodplain. And I think HUD will apply a feasibility test to determine whether or not there's adequate flood-proofing. You must have an early warning system and evacuation plan to areas outside of the floodplain. We have one project right now that's in that situation. They're an existing project in a 500-year floodplain, and so we've been working with them on their evacuation plan and have actually a sample model that you can use to put together one if you haven't done it before. And then if you are in a 100-year floodplain, you must have flood insurance. Okay, we're going to move on to the funds requested worksheet, which is where you tell us how much subsidy you need. And Janet from CalHFA is going to go over that in more detail. And I have to say, that's kind of the hardest part of the whole application process, which is basically narrative, question, and answer. And even that we've automated to an extent where it is very easy. So, and that is in large part to Janet and Dina's efforts, which I really appreciate.
Thank you, Christina. As mentioned earlier, the applications will be accepted beginning on March the 16th. One of the components that you'll have to complete in the 811 application is the funds requested worksheet. This worksheet will provide us the information on the project, the breakdown by bedroom, the number of units, and the actual targeted AMI, along with the maximum gross rent that you will be using from the tax credit rents that are published. You will complete the areas that are shaded on the worksheet, and the white cells will then be auto-filled for you, and it will calculate then the total Section 8 rental subsidy for your project. Please fill out the project name, the address. The important field that we will need is your county and the place in service date to determine the rents. For projects that have not yet completed construction, the rent limit in effect at the date of the tax credit reservation letter will be used to determine the rent. If you don't have a place in service date, then you'll be using the tax credit rent in effect of your date of your 811 application. And then for projects that have a place in service date, you'll be using those rents. The total tenant payment that you see here on column F of $267, that's going to be a fixed amount because that's the amount that we used in our 811 PRA application to HUD as the average total tenant payment. The estimated rental assistance, column H, this is the difference that we will be paying for the difference of the total tenant payment and the 50% of the AMI rent published by tax credit. So this is an example of a completed worksheet, and this is provided to you also on our website for you to follow. You'll see that for this particular project that we have a sample of, it's obviously in the county of Los Angeles, and they have a place in service date of March the 2nd, 2014. You will be completing, in this example, there's 3 different bedroom types, a studio, a 1-bedroom, and a 2-bedroom. The number of units for each of the bedroom types. the targeted AMI of 30%, 40%, and 45%. You will be looking based on your place in service date, and what I have on the right-hand side for you is a extraction from the Tax Credit Allocation Committee rents for projects placed in service between December 18, 2013 to March 5, 2015. And that's based on your place in service date of March of 2014. So for the studio apartment, you would look at the 50% rent limit to figure out what the rent should be. In this case, it's $726. For the one bedroom, 50% AMI is $778, and for the two bedroom is $933. So once you complete the shaded area, as I mentioned, everything will be auto-filled for you. And on the bottom, you will see the total Section 811 rental assistance that you will be requesting, which in this case is $198,583.
And that's over the initial 5-year period with an escalator for inflation and tenant rent.
Right. The tenant inflation is 1%, and the rental assistance is set at 3%. At this time, we'll go ahead and take any questions. If you have it, please type them into your question box.
And Janet, can I also point out too that we have projects that have their rent restrictions through their development finance source currently at 50% AMI, and they're still using the 811. So they're not necessarily getting a bump in that they're not putting the 811 on top of, say, a 30% or 40% unit. And the 811 assistance is only then providing essentially the rental assistance the tenant needs without extra cushion for you. That's still okay for us, you know, but we assume that most people will want to put the 811 assistance on those lower AMI rents to also get that bump up to 50%. And that's the way the sample was prepared. But as long as you don't exceed 50, so you don't lose money, we're okay with you putting it on top of a unit that's already restricted to 50% AMI.
So we do have one question. If there's more questions, please go ahead and type them in.
Okay, so the one question is this session being recorded? If so, can I get a link to the recording? I think we'll determine, the session is being recorded, but we will determine whether or not the recording is good enough to post onto the CalHFA website.
The sound quality.
The slides will be posted on the website.
Good morning, everybody. This is Urshela Starr, and I work for the Department of Healthcare Services. And I'm going to talk about Medi-Cal funded services and supports for the tenants that would be eligible for this 811 assistance. So I'm going to talk a little bit here about supportive services. All PRA tenants will be Medi-Cal members. That's a for sure thing. So everybody will need to qualify for Medi-Cal, and we will be checking Medi-Cal eligibility and make sure that they do have proper aid codes. And I just want to say, in some individuals, if they, let's say, did not have legal status in United States, they could be receiving Medi-Cal on a temporary basis if they had an accident and they were in the hospital. But once they, and Medi-Cal may pay for that, but once they got out, because they didn't have legal status, then their Medi-Cal would go away. So that's one of the things that we will be checking to make sure that they do qualify for Medi-Cal. And also, along with that, that they qualify for at least one of the several long-term care services, such as home and community-based services, waiver services, state plan services, or rehabilitation option specialty mental health services. So, you know, this is kind of a big range, and a lot of, I'll give a couple examples here. You know, when I say waiver services, that could be the DD waiver, that could be the nursing facility waiver. We have several different waivers. They could be eligible for IHSS. So that's the other type of thing that we will also be checking under their eligibility. Tenants who are non-homeless and referred by DHCS or DDS will have all of their supportive services in place upon moving. So that's one of the things that both DHCS and DDS as organizations do. So if our individuals are coming out of skilled nursing facilities, we contract with providers, and they are the ones that are going in there and setting up that service so that once the person moves into their apartment, that they will have those services. And DDS also does the same thing. They contract with supportive service agencies that also performs that service. So supportive services funded by Medi-Cal for nursing home transitions. And like I said, we contract with providers, and these are the types of things that providers are doing. They're doing whole person care plans, case management, habilitation after they move into the apartment to make sure that, you know, these are like tenancy support services to help that individual be successful and to continue to stay out. If an individual needs skilled nursing, we would also be able to provide that through Medi-Cal. Personal care services, if they needed to have medical equipment or medical assistive technology. Under our Money Follows the Person, the California Community Transition Program, we have funds to be able to provide that. These are some additional services for nursing home transitions, and I just mentioned through the California Community Transition Program, and that may include right now, if a person was coming through the California, they were enrolled in California Community Transitions, or otherwise known as the CCT program, we can pay up to $7,500, and those $7,500 funds could include furnishings, their first or possibly second month's rent, depending on if a person needed a little bit more time to get their services in place. That could also be security deposits. And when it comes into home accessibility modifications, we actually have another pot of $7,500 if they needed to maybe have a doorway widened so that it was wheelchair accessible. So there's a lot of things and supportive services and funds available to help these individuals and to be able to do case management and to follow them in their apartment so that we can provide those tenancy supports so that they'll continue to be successful. And kind of on that same line, services and supports for Department of Developmental Services, Regional Center Tenants, they also do case management. They do supported living or independent living services, health and community supports. They provide adaptive equipment and environmental modification, day activities, and vocational services and supports. And then two, I just also want to make that that connection along with DDS and DHCS. You know, we both, DDS too, they do long-term case management too with those tenancy supports to help that individual be successful in their apartment. Here's some also additional services for the Regional Center Tenants, which may include transition setup supports for individuals leaving an institution may be available to assist a consumer to transition from an institution back into the community. These services may include moving expenses, one-time setup fees, utility deposits or security deposits that may be required upon to attain a lease for an apartment. So I'm going to talk a little bit about, this is going a little bit out of not my department, but I'm going to talk about this, and if there's specific questions and I can't answer these because I'm kind of speaking on behalf of LA County Department, then we can forward the questions to them and get back to you. So services for LA County Department of Mental Health tenants, these may include psychiatric assessments, ongoing case management, individual and group therapy, rehabilitative groups, crisis intervention, medication support, and psychiatric services. And this is referral for tenant referral for non-homeless persons. So PRA eligible individuals and available units will be coordinated by a State Department of Health Service coordinator. And we're in the process of developing that system right now. Project owners or their agents will notify Department of Healthcare Services for available PRA units for non-homeless households. And I just want to go back, the non-homeless households that we have spoke about are coming out of an institution, a person who is coming from is followed by the Regional Center, a DD consumer, or a person who is with County Mental Health, and they are being referred to us by County Department of Mental Health. DHCS will verify eligibility, and when I say eligibility, I'm talking about Medi-Cal eligibility, create and maintain a tenant registry, and we will notify the non-homeless individual or their referring agency, which could be their agency, that could be their case manager, to apartments when they become available. Tenant referral for homeless persons. PRA eligible homeless persons will come through the Los Angeles LA Coordinated Entry System, or CES. Project owners or their agent will notify CES of available units for homeless households. Prioritization for housing will be based on Medi-Cal eligibility, and they'll probably at this point contacting Department of Healthcare Services to get that Medi-Cal eligibility, and then also how they score in a priority on the VI-SPDAT. Projects receiving Section 811 assistance or Housing Authority project-based vouchers must enter all information into the county's Homeless Management Information System, or otherwise known as HMIS. And with that being said, is there any questions at this time?
The question is, who or which department will we contact regarding these additional services for people transitioning from regional center facilities? You can either contact me at the Department of Developmental Services. I'm Yvonne McQuistion-Tucker, or you can contact the Regional Center directly about services that they provide.
And our contact information is at the back of the slides.
Do we have any more questions? Okay, at this moment it doesn't seem like we have any more questions, so I am going to turn it back over to Janet from CalHFA. Thank you very much.
Thank you, Rochella. I wanted to just review the 811 award process once we have a successful applicant that's selected for the PRA. CalHFA will issue an award letter to the project sponsors. The letter will specify the 811 contract amount and the number of 811 units that was calculated from the funds requested worksheet that I reviewed a little bit earlier, along with the directions that certain documents will need to be executed and recorded. You may execute an agreement to enter into a RAC, which is known as an ARAC, and these are for projects that are either under construction or under rehab at the time of the award. After the project is completed, we will then enter into a rental contract, which is a RAC agreement, and then also a use agreement. An ARAC will be used for projects under construction, undergoing rehab, or not yet ready to start after the 811 award. CalHFA and the owner will enter into the ARAC, and this is a commitment between the CalHFA and the owner to enter into the rental assistance contract upon completion of the project. The rental assistance contract there's two parts, part 1 and part 2. We will enter into the RAC with the owner for a minimum of 20 years with initial funding for a period of 5 years. After the 5-year term, the 811 program is subject to the annual federal appropriation, just like the Section 8 project is under federal appropriations annually. Both CalHFA and HUD anticipate that future funding will be available for the 811 program. But in case Congress does fail to appropriate funds, HUD will not require CalHFA to enforce the RAC or the use agreement. The RAC will provide the rental assistance payments to the owner for eligible tenants in eligible units. It will identify the project, the number of contract units by bedroom size and accessibility, and the term and conditions for receiving the rental assistance payment. It will also provide annual certifications to CalHFA that the 811 assisted units are occupied by eligible tenants and that regular physical inspections of these units meet the UPCS standards for housing that is in decent, safe, sanitary, and in good repair. The use agreement, where the owner will agree to record a use agreement for no less than 30 years. During the use agreement period, the owner shall make the approved number of assisted units available for occupancy only by households that meet the eligibility requirement. And again, if the use agreement will not be enforced or may be terminated if funding is not appropriated by Congress. At this time, Sue Dearney will go over the tenant rental assistance certification system for round 2.
Hi, this is Sue Dearney with California Housing. I bring up the rear end and take the projects through the next 30 years maybe to deal with the subsidy from HUD. So once the tenants are moved in, we then follow the HUD Section 8 process, and we would require that management have knowledge of the HUD programs, like the HUD Handbook, TRACS, IMAX, the TRACS MAC Users Guide, and also we'll be using the EIV system. This is all items that anybody with experience of Section 8, which we anticipate that management would have, would understand. Once the tenants are moved in, they're certified annually on their income, and the certifications are then transmitted through to us, and we transmit it onto HUD into their database so that HUD can track the use of the 811 funds, and the certifications indicate that how much the tenant needs to pay by way of their rent, which would be 30% of their adjusted income, and the balance of the gross rent is paid by HUD in the usual way under Section 8. the management will submit what is known as a child voucher monthly, which is a total of the, depending on how many units they have and how many tenants they have, they will request the assistance funds from us. And under the round one, we currently have 4 properties who are submitting and requesting HAP funds. So when they submit their vouchers to us, we will then roll it up into a parent voucher, and that is what is sent to HUD, and HUD will pay the funds through the parent voucher, and then we receive the funds here, and it's then forwarded out to the property by way of assistance. And here's a small flow chart which shows you the process for the next 30 years, hopefully. And I think that's, I think the flow chart is fairly self-explanatory. As I say, it's a monthly process.
Thank you, Sue. Yes, this process is extremely important because in order for you to receive your assistance payment, you must be familiar with the track process. So if you have questions or concerns, please feel free to give us a call. The number is on the contact sheet. Thank you. Thank you, Sue.
Okay, we have listed the contacts for all of your resources. For housing questions, please contact Christina Del Francesca. For the tenant referral and supportive services, you can contact Rochella or Yvonne. For CalHFA, if you have any 811 tracks or HUD questions, you can contact Sue or Smyra. And for the rental assistant contract, you could go ahead and contact myself, Janet. At this time, we'll go ahead and take any last questions that you may have, so please type them in. Okay, it seems like we don't have any questions. I would like to thank you for your time in listening to this 811 presentation. Like we said, we will go ahead and post the slides onto our website, and also the webinar if the audio does seem to come out okay. And this is our link to our website. Please feel free to look at the site. Information is updated as things tend to change a little bit. But if you have any questions, please go ahead and contact any of us on the contact list here.
There's our sample racks and use agreements there, as well as tenant selection plans and the other application documents. So it's a really good website and provides you a lot of resources.
All right, thank you, everyone.